Hello there, my name's James Harrison and I am the chiropractor at Connective Chiropractic in Basingstoke. What people commonly ask me, what is the most common issue that comes into... Hello there, my name's James Harrison and I'm the chiropractor at Connective Chiropractic in Basingstoke. Now people often ask me what's the most common issue that comes into the clinic and what's the one thing that probably winds me up most as a chiropractor in terms of what people say that they come in with but actually often don't come in with, if that makes sense. So the actual common issue that we find people come in with is low back issues. But one of the things that people tend to talk about more than anything else is sciatica or sciatic type pain. And it's often not as clear-cut as you may think. In fact, I'd go so far to say that it is perhaps one of the most commonly misdiagnosed issues that we see within the clinic. And yes, you heard me correctly there. One of the most common misdiagnosed issues is sciatica or sciatic pain. And there's lots of reasons for this. And sometimes people are self-diagnosing that, sometimes it's being diagnosed from professionals who, forgive me for saying, ought to know better about the anatomy and what is going on behind the scenes of sciatica. So I wanted to do this video just to explain it, because when you are going through these pains, it is quite frustrating and it can lead you to do a whole host of different things. And it is good to know what you're playing with before you even get it checked out. So you know, before you come into a clinic such as mine, whether you're talking about sciatica or whether it might be something else. Now, I'm going to talk a bit about anatomy to start off with, if I may. So sciatica is really talking about the irritation of a nerve. But sciatica, it's, from that definition itself, is not really an issue in itself. It's not a diagnosis. It's a collection of symptoms as a result of that irritation of the nerve. So when you come in and say, I've got sciatica, what you're actually saying to a professional like me is, I've got sciatic-like symptoms, which essentially is telling me that you've got an irritation of nerves stemming from that low back region that is radiating through. If it's just in that low back region, it's less likely to be sciatica because there is a defined anatomy when it comes to sciatic type pain. Now I've got my little model here. So this is of the spine, the back of the pelvis, the sacrum, if I turn it round, and you can see that you've got the nerves here represented, which way is it going, by the yellow bits on this model. Now the sciatic nerve is a bundle of nerves, so it's not just one nerve on its own, and people commonly think, oh, my sciatic nerve is being irritated. It's not. It's a bunch of nerves that come from this low back area. In fact, it's from about L4, which is low down here, down to about S3. So it's this sort of area here, which we're talking about. So all these yellow bits that you can see on this model branch off to make one big nerve that runs across the pelvis, through the buttock area, and down into the leg. In fact, the sciatic nerve is the longest nerve within the body. And it goes right down to the bottom of the leg. So if you're getting aches and pains that are not going all the way down the leg, the chances are you've not got sciatica. You could, however, although this may be a bit more academic, have an issue with any of the nerves within the branch of the sciatic nerve. But is that sciatica? I'll leave that to you. But personally, I would suggest as a professional that it is something going on with an irritation of a different nerve or branch of nerves within that sciatic bundle. And there can be lots of nerves that innervate, they control different areas down the leg or that lower limb or cross into the buttock. So things like the superior or the inferior gluteal nerve goes into the buttock, for example, or the posterior femoral nerve, or the pudendal nerve, which is to do with toilet, bowel and bladder functions. So if you come to us incidentally in the clinic, you'll notice we ask you about bowel or bladder functions if you've got low back issues. And that might be part of the reason why. There is also another reason why we ask you that question, and I'll talk about that later on. It's actually a little bit more severe than where we're talking about at the moment. But essentially what we're talking about is this bundle of nerves that get irritated in some way and create this feeling of pain, this sciatic pain. And it's a very special type of pain in the respect that it has its own set of words that people use about it. It's kind of burny, pins and needly, funny, sharp. It's kind of a weird pain. But people do come up with lots of different words for describing it, so I wouldn't pin your hopes or your diagnosis based on the words that you're choosing to describe it. But it can be caused by lots of issues. So as I said earlier, it's a set of symptoms rather than a diagnosis itself. And so it doesn't just cause itself, it just doesn't happen on its own. There's a reason why you get the irritation of that nerve. And my job in an initial consultation, in an onboarding session, is to figure out exactly what's causing that, if we believe that sciatic type pain is going on in your case. So the common thing that people think about are disc issues. So I want to explain a little bit about disc issues. So here's another model. So this is of the lower vertebra, and as you can see, you've got the nerves here, and you've also got the disc, which is by this sort of jelly-like red substance. Now occasionally if there's a disc issue, what happens is the discs don't slip. What happens is they tend to prolapse, they tend to move out. And what can happen, I wonder whether this model will do it for you. Yeah, there we are, I don't know whether you can see it, is you can get a little bulge that happens, or it can actually herniate down across the vertebra itself and can start to push on some of the nerves in that area. Ergo, you get irritation of a nerve. It doesn't mean that the nerve is always compressed. We talk a lot about nerves compressing, but actually it doesn't have to be even that global. It can be actually just simple irritation. There's something in that space, and the space changes, and as a result there's an issue with the nerves. I mean, it can be lots of things. But that gives one example of many into how this might start. But that in itself is just one segment. That's just one level. So you can get different symptoms with different branches or different areas of that nerve. So it can be quite complex, or much more complicated than most people think. But that's quite a severe example to start off with, and a severe-ish kind of example in terms of how sciatica is caused. But there are other things that can create sciatic-like symptoms, and we see these a lot. The first thing is actual nerve issues. So if there's actually nothing going on with this area, but it's actually to do with this part, it's the nerves itself, of course that's going to create aches and pains. Muscle imbalances can create changes as well. So there are muscles that will link onto the spine and around the spine as well. And if there's something going on that's creating a mechanical pull or mechanical stresses onto your spine and the rest of your body, that can in turn irritate or create tension within the nerves. And one of these examples with regards to muscle issues is a muscle called the piriformis muscle. Now this runs, literally, if I bring my model back up again, in this, oh hang on, let's figure out which way it is, in this sort of area, in this sort of lower buttock, lower pelvis area. And the sciatic nerve will branch through that area and down into the leg. And sometimes, in some people, there is an anatomical variation. It's completely normal. But sometimes, some people have that sciatic nerve running through the muscle belly. And as a result of things getting tight in that area, that muscle imbalance, what happens is it can actually create tension across that nerve and create extra feelings of irritation. And that can create a nerve signal down the leg. So there it's actually not that difficult to sort if it's a piriformis issue, although you're getting really nasty type pains. But the presumption is, and this is what we find a lot, is that it's one of these disc issues, and often it isn't. It's something that's a little bit easier to sort, and that's where chiropractic really comes into its own. Mechanical issues happen as well. So if you think about the pelvis being a bowl, and it's sort of held in position by tons of different muscles and ligaments and connective tissues. If there is an imbalance at any one point, that can create an imbalance also, or upset into that nerve system. So for example, in certain issues like sacroiliac dysfunction or sacroiliac joint dysfunction, we're looking really at these joints here. Now look how much yellow is around this area. You don't need to really be Einstein to know that there's a lot of yellow on this model, and that those yellows represent the nerves. So if something's going on with how these joints are articulating, you can get irritation on those nerves. And again, it can be more superficial, but if it's really kind of going there and it's the branch of that sciatic nerve, it could go right down the leg. Other issues could be things like lower cross syndromes. This is a little bit more debated in some of the research terms out there, but when you get a tipping forward or back of the pelvis as a result of that balance of muscles not being as balanced as it could be. So these are things that can create that irritation, but I hope it gives you an idea from this video that there are lots of different reasons why you could be getting sciatic type pains down the legs and into the buttock and lower back area. Sciatica in itself is not an issue in the respect that there's a reason for that being there. And often you have to kind of go behind the scenes, figure it out. And as I say, that's what my job is in an initial consultation, in an onboarding session. The key thing I'm going to say is get it checked, because ultimately things can become more severe with time. Depending on what's going on in your circumstance, there can be a whole host of nasties. So one of those things that we mentioned earlier was about the pudendal nerve, and this actually can create bowel or bladder inconsistencies if that is irritated. And there are some really severe issues, such as cauda equina syndrome, which is where certain types of muscles are pinched and you lose your own self-control, and it can actually lead to other complications down the line. In fact, it's one of the reasons of many we ask the crazy question of, have you noticed any changes in bowel or bladder frequencies if you come into the clinic? Because it's so important to screen that out, and often that is something that chiropractic can't help with. We have to refer you out pretty quickly, actually. So it's one of those things that if you are noticing bowel or bladder frequency issues and you've got low back pain, it doesn't hurt to be cautious and come in straight away to somebody. It doesn't have to be me, it can be anybody, but get that checked out straight away. And it is really good also to make sure that you know what the cause of those nerve pains are if you've got them. There is normally always a cause, and if you don't know what that is, you don't really know how to manage it, and hoping and praying that it will go away on its own doesn't always work. So what can you do if you've got aches and pains right now and you want to help yourself? Well, 9 times out of 10, unless there's a real severe bulge going on, I love this model, have you noticed? Unless there's a real severe bulge in those, and that's pressing those nerves and it's quite severe at this moment in time, then actually motion can be very beneficial. But note I'm using the word motion and not exercise at this point. Because what you don't want to do, and I say this because I do have patients who love to do this, what you don't want to do is you don't want to go out and exercise and go completely crazy. You don't want to be running a marathon. You don't want to be doing loads of huge things until you've got it checked out and you've got the all clear. But motion, movement, keeping it going tends to be really beneficial. And often most things in the body do when it comes to aches and pains. Often motion is the key. And living a sedentary life, resting because it's sore, often isn't the advice. But there are exceptions to that, so it is again one of those reasons to come and get it checked out, rather than just sit at home and worry about it. But I hope that gives you a few little tips and tricks for now, in terms of figuring out what's going on. Keep it moving, keep it going as much as you can. Now you can also, depending on what's going on, use cold and heat to your best advantage here too. If in doubt of which one to use, contact a professional. And I say that because some of these issues behind why you can get sciatic pain can be helped by cold and hindered by heat, and vice versa. So you can actually do the wrong thing in the wrong circumstances. So this is where coming in to see me, for example, or going in to see another professional for some examinations are really key. And if you've got a diagnosis from a professional of sciatica, know that it's not right. There's a reason behind that, and ask the question, so why? Because that goes into the detail as to why and what is actually going on behind the scenes. And also, I'll say this as a bugbear of mine, if somebody's giving you a diagnosis of sciatica or sciatic type symptoms but has done very little in the way of testing, then they're kind of making it up. So you want to make sure that they've done a little bit of testing to understand exactly what's going on. Have they ruled out whether it's a disc issue? Have they ruled out whether there is a muscular issue or the like? And chiropractors are really well placed to do this. It's part of their training, their master's level training, is to understand exactly what's going on. And on an onboarding session, it does seem a little bit like we're detectives in some way. We get all the information, we blow it out of proportion, and then we hone down and we figure out through the testing exactly what's going on to the best of our abilities. And it's really quite interesting. It can be quite exciting as well to find out what's going on And it's not uncommon for people to come in with issues that have been with them for years to realise that it's something quite simple that can be sorted quite quickly, effectively and easily, often because of self-diagnosis, poor diagnosis, or because they just don't know the anatomy. And so that's why I wanted to do this video. If it's of interest or intrigue, you want to know more information, feel free to message me. This video's here, you can post below. I'm happy to look into it and answer any questions that you might have. But there's some of the myths about sciatica and sciatic type pains, and also some of the things that you might not know about what chiropractic can do with it too. In fact, there's so much research about low back issues and sciatic issues and the like that the ASA, the Advertising Standards Authority, have even said that we can say from the rooftops that we are effective at helping with it. But you know what my issue is. Sciatica is not real as a diagnosis. So that's a little bit disjointed. That's another weird thing. But either way, I'll leave you with that one. But if you've got low back issues and they're radiating through down the leg, get it checked out. And if you want to, we're here to help. And if we can't help, if you're not in our region and you want a referral to somebody more locally to you, let us know too. We'll be happy to help. Have a great day.